Hello, I'm Dr. Christopher Larson of Larson Eye Care. I prepared this program to help acquaint you with the procedure of LASIK or laser refractive surgery. Through this presentation, I hope to acquaint you with the anatomy of the eye, the nature of refractive surgery, some historical aspects of refractive surgery, and how it has evolved into the wonderful procedure that it is today. I'll also talk more specifically about the experience you can expect at Larson Eye Care. One question that comes up early among people who are just learning about refractive surgery is what kind of visual outcomes can be expected. At Larson Eye Care, we use advanced techniques such as custom view LASIK, a form of laser surgery which utilizes wavefront measurement of your visual needs prior to the actual laser treatment. Custom view wavefront testing measures much more than just your need of spectacle lens power for vision. It actually is more than 25 times more accurate than conventional refractions and finds many subtle abnormalities in the way that your eyes focus. It allows the laser to address each of these abnormalities. With this new technology, our experience is that 95% of people having LASIK surgery can expect 20/20 vision or better, and 99% of patients will see 20/25 or better following the surgery. The 20/20 and 20/25 expectations include a 5 to 7% chance that additional laser treatment or retreatment will be necessary. This also means that between 93 and 95% of patients undergoing LASIK surgery can expect between 20/20 and 20/25 vision following a single procedure. For those of you who are 40 years of age or older, a physiologic change in the eye is beginning to occur, one which creates a requirement for reading glasses or bifocals. This change is something that is predictable, begins normally around the age of 40, continues through the age of 65, and with each incremental increase in age creates a greater need for either reading glasses or bifocals. LASIK surgery does not alter these physiologic changes occurring within the eye, and for those of you who are electing surgery and are within this age group, you can expect to need reading glasses after the surgery. This need for reading glasses is due to a loss of accommodation. Because of these changes in the eye, we ask that you choose either to have both eyes corrected to see well in the distance and rely on reading glasses after surgery, or have one eye corrected for near and one eye for distance. So working as a team, your eyes will provide both distance and near vision. This is called Monovision, and it works very well in patients who have well-established dominance in one eye. Some patients, in order to retain better reading vision, choose to preserve some near vision in both eyes and sacrifice distance vision quality. Now that I've talked a little bit about what the LASIK procedure accomplishes, I'd like to take a moment to talk about those things that worry or concern patients about the outcome of their surgery. LASIK surgery has been done for many years, and the incidence of problems or complications is very, very low. In fact, this surgery, which was originally done one eye at a time, received approval by the FDA in 1998 as a bilateral simultaneous procedure. Now bilateral LASIK surgery has become the standard of care. We look at LASIK as being a very safe procedure. When you talk to friends and relatives, I'm sure you can find many who have undergone LASIK. I've performed LASIK surgery on many people. The numbers include our own patients as well as friends, relatives, members of my family, and professionals such as other physicians, dentists, and attorneys. I feel that I am recommending a procedure which I consider very safe. My personal experience performing LASIK dates back to 1995. I began performing LASIK in 1995 and later brought the procedure to Sheboygan in 1998. I would like to, for a moment, talk about the risks that are related to this kind of surgery. They can be broken down into the following categories: infection, dryness, flap-related issues, and glare and halos around lights at night. The first risk, infection, is very rare. In the years of my doing LASIK surgery, I've not seen an infection significant enough to cause visual impairment. the risk is very low. Nationally, the incidence is quoted as being about 1 in 5,000 patients. Though this is very rare, we think we should discuss it with you as a part of the information we share, because should an infection involve either eye, it can cause a decrease in vision and additional surgery may be required. To reduce the risk of infection, we use antibiotic drops before surgery and ask that you stay on these drops for a period of time after the surgery as well. We ask women to avoid eyeliner or mascara, and we also ask men and women to avoid hot tubs and swimming in swimming pools for a period of 2 weeks. The second category, dryness, should be mentioned because everyone following LASIK will develop some dryness, probably for a period of 3 months or more. If there is a pre-existing dry eye condition, it is not unusual that artificial teardrops or some kind of lubricating drop be used during the first 3 months. This condition is not as common in a different laser refractive procedure we do called advanced surface ablation laser correction. This is a procedure where the surgery is done without making a corneal flap. We call it EK, or advanced surface ablation, and it's done in some patients with very specific indications. For patients who have unusual dryness beyond a few weeks or months after surgery, we recommend temporary plugs to close the tear drainage system, or oral medications which increase tear production during this period of healing. The third category is called flap-related complications and are seen only in those patients where a corneal flap is created as part of the surgery. These are listed separately from the dryness problem I mentioned earlier. For example, a corneal abrasion may occur either at the time the corneal flap is made or following the surgery. An abrasion typically heals very quickly using either ointments or artificial teardrops. Occasionally we use a bandage contact lens which is fit for comfort and to aid in healing. The bandage lens is worn for days or sometimes for an entire week, mainly for comfort. Another example of a flap-related problem is called keratitis. This is an inflammation that occurs underneath the flap. It is not related to an infection and typically clears with the use of a drop called a topical steroid. In some instances, however, the flap needs to be raised, something we do simply in our office, and a small amount of sterile irrigating solution is passed under the flap to flush away any material that might be causing the inflammation. If keratitis occurs, the topical steroid may need to be used 4 times per day for 6 weeks or more. The risk of glare or halos is something that we saw more frequently with the earlier laser technology and seemed to occur mainly in patients who had very large pupils and dim or dark illumination. These patients occasionally complained of starbursts or halos at night after LASIK surgery, and for some, it was a debilitating problem. It is for this reason that we insist on using custom view laser treatment, especially in patients who have pupils that are greater than 6 millimeters in dim illumination. Custom view laser treatment has been our preferred treatment since it was first introduced in 2004. With this, we have reduced or eliminated complaints related to glare or halos at night. Many people with large pupils are already aware of some glare prior to considering refractive surgery. It is interesting to note that most patients with large pupils find that after having custom view LASIK surgery, they actually have less glare and fewer halos following the refractive procedure. This, again, is a reason that we at Larson Eye Care have made a major commitment to using custom view LASIK on our patients, and it has been a major success in the advancement of laser technology over the last several years. The problems that I have discussed are very infrequent and, when they occur, are usually relatively minor and do not interfere with the visual outcome. We at Larson Eye Care are very enthusiastic about LASIK surgery and feel that it is a very safe procedure. If you have further questions about refractive surgery, we would be happy to visit with you and answer them. We know that you have many choices when it comes to choosing a laser surgeon at an eye care facility, and we are very happy that you have chosen to discuss your decision with us.